a patient presentation from the Institute for Neuropathic Pain.
Our next patient is suffering from chronic idiopathic axonal polyneuropathy. She's from 1951. And Harma, we first saw each other, I think, more than 1 year ago.
Yes.
And then you came here with quite some pain. You were suffering from pain, although you had regular medication. What was your pain score when you first saw us, say 1.5 years ago?
When I first saw you, I had pain on the scale from 1 to 10. I think 7 or 8.
Mm-hmm. And there were many things you couldn't do.
Yes, there were a lot of things I couldn't do. I couldn't walk. I couldn't stand. Yeah. Mm-hmm. And it was I couldn't even sit quietly because every time I was resting or sitting or trying to eat something, my legs were burning and feeling awfully
painful.
Yeah.
And then we started with our protocol, and part of this protocol was classical medication. You try in patients suffering from CIAP and pain, like Neurontin and amitriptyline and tramadol, and some extra supplements. And although the pain responded, I think still after a year there was pain.
There was still too much pain, yes.
Yes. And then I think 2 months ago the neurologist looked at your nerve velocity with an EMG, and she did see some clear signs of axonal polyneuropathy. So 2 months ago we started prescribing the palmitoylethanolamide from a producer in Italy, a compound which has been developed by a pupil of a Nobel Prize winner.
Oh, yeah.
It was Professor Riva Montalcini. Actually, she's still alive.
Oh yeah, I read something about her.
But she's 102 now.
Oh.
The Italian Professor Montalcini won the Nobel Prize for her work on nerve growth factors.
And the nice thing of palmitoylethanolamide is it's a body-owned compound, and we have clear indications that for neuropathic pain it is an interesting option. So 2 months ago you started, and what did you notice?
At first I didn't notice very much, but after a few weeks I thought, is my pain becoming less? Or isn't it? I didn't dare to say it or to tell it to somebody because I thought, when I tell it, it isn't true. And I noticed it more and more and more, and sometimes it is a little bit
waxing and waning.
Yeah, but now after a few weeks, 6 weeks, about 6 weeks, I really think it's going better. I have less pain, and sometimes I think I don't have any pain.
Okay.
It's really true. And one time I stood up in the morning. I came out of my bed and I thought, I have no pain. So it was a very strange experience, but. And I nearly didn't dare to believe it because it couldn't be true, but it is true.
Yeah. Okay.
Yeah.
Harma, it's a clear story. Thank you very much.
Okay.
We continue to treat you with the normals, with the palmitoylethanolamide, and or ethylamides, I should say. And meanwhile, we have treated more patients with CIAP, and we often see good responses, always between 3 and 6 weeks.
Yeah, okay. Yeah. So. Oh, that's very good.
Yeah. Thanks for your information.
Okay.
And we end with a quote of Rita Levi-Montalcini. Progress depends on our brain. The most important part of our brain, the neocortex, must be used to help others and not just to make discoveries. A presentation from the Institute for Neuropathic Pain in the Netherlands.